Please welcome the panel on Silver Threads, Weaving the Caregiving Tapestry, moderated by anchor and journalist for MSNBC and NBC News, Richard Louie.
Well, welcome everybody. Good to see you.
Good to see you.
Hello, Milken. Yeah, everything good? All right. As I put on this mic, we're going to start today with a special guest. That special guest is called LQ. And so with a special message for all of us as we gather for this discussion on caregiving is LQ, stage left.
Hey there. Who do you want to message?
Sorry. Wait a second.
LQ, get it right, would you?
Hey there, and welcome to our session on Silver Threads. My name is Ellie Q, the sidekick for happier and healthier aging. I'm 8.5 inches tall and 5.75 pounds. My hobbies are standing here, talking, learning new facts, and dancing. I'm like your whimsical wizard, wielding the powers of AI and companionship. I can remind you to take your meds, we can exercise and play cognitive games, and make calls to your loved ones. We can even use my AI powers to write poetry together. Just say my name and I'll be there for you. Actually, you don't even really need to do that, since I can start the conversation on my own too. Now, please welcome the rest of today's panelists.
LQ, thank you so much. And with that very note, please welcome to the stage Yvette Nicole Brown, actress and caregiver. Hon Pak, Senior Vice President, Head of Team, Digital Health Team, Mobile Experience at Samsung. Doris Scholar, who is the founder and CEO of Intuition Robotics. And horse whisperer to LQ, as you can tell. Kai Walker, Head of Retirement Research and Inclusion Transformation at Bank of America. Naimesh Patel, President of Healthcare Practice at Red Cell Partners. All right. What we're going to try to do in the next hour is look at the future based on where we're at of solutions and possibilities across various sectors of society on caregiving, a topic that is, as all of you know in this room, a big black box, not only culturally, but also in practice and when it comes to solutions. And no better group to address all of the various legs of that important stool in our society than our panelists today. And I want to start with Yvette Nicole Brown, who made not a lot of people know that you decided to step away from a hit series on a great network called NBC News. I'm not plugging here. NBC, excuse me, NBC. From Community because of something that changed in your life. And
Yes.
What was that?
My dad got diagnosed with dementia, and we were doing Community. It was 16-hour days.
Yeah.
And when the show got canceled on NBC, I went to Cleveland to get my dad, and then the show got picked back up, and I was like, oh no. And I realized that I couldn't.
Oh no, not many people say that, by the way.
Well, I mean, family first, right? So
Yeah.
I was really concerned because I knew that I couldn't work those hours and still adequately care for my dad. So I asked Sony and Dan Harmon if they'd release me, and they kindly did. So I left that show to care for my dad.
Any regrets?
Not a one. Not a one. It was the best decision. This is what I always say. Caregiving is the best tough decision you'll ever make, or the toughest best decision you'll ever make. There's been ups and downs, and it's a roller coaster ride, but every day I go into his room and he knows who I am, and we get to laugh about something, or I get to retell him his story, which is what we do. We're the caregiver of their memories, as you know,
Yeah.
when they have dementia. Every time I get to do that, I am reminded what a great choice I made.
Han, depending how you count it, 53 million family caregivers, unpaid, untrained. We're talking about $750 billion of unrealized value in the American economy when we're just talking about family caregivers. That is gargantuan. At Samsung, how are you addressing that untapped value?
So I think we're still early in the stage of learning what this means.
Yeah.
Yesterday, we had the opportunity to talk at the council meeting about what's happening economically and the implication of longevity to the workforce. But then as we now put that scope back into the caregivers or the informal caregivers, it's very clear that separate from what you just stated, healthcare has a crisis where care is shifting into the home. So I think there's a tsunami coming, and the informal caregivers are not ready.
It's here, some might say.
Yeah, I would
Some
say.
might
is,
say,
like, yeah.
and it's just the beginning, and so that's the
Right.
crisis. And
We're just
so-
seeing it maybe, right?
Right.
Right.
And we're putting a name to it to
That's
some
right.
degree, although I think as we talked about off stage, I think part of what's very interesting to me is that whenever I go speak in front of an audience, they emotionally resonate with this idea that caregiving, caring for one another is important, a family, but yet from a market perspective, the need's there, but yet the market has not consolidated
Huge gap.
in any way.
Yeah.
And so I think there's clearly policy, reimbursement, all those things that are mixed in. So it's fascinating to me. So with that in mind, Samsung, obviously we're a global consumer electronics company. Like, why would we even care, right? Well, one, we have our employees that are caregivers.
Sure.
But we, in our goal to improve the health of billions of people, I think our honor that we have as a company is that we're a trusted brand in the home already.
Sure.
So as care is shifting into the home, we're already in the home.
Yeah.
Right? And so with that, we think we have huge responsibility to do that correctly.
Yeah.
We think that this isn't something that we alone are going to be able to.
That means my mom's calling, by
Yeah.
the way. It's the
might wanna-
only
Caregiving.
call that's allowed
You sure
to
you don't
go
wanna pick it
through.
up?
No, I'm not gonna.
Caregiving is all the time.
It is, yes.
Yeah.
So,
Family first.
She's got the emergency little star. But,
I love it.
so I think that in the technology, as we connect the devices, and we'll talk about that later, I think what we have to tap into at Samsung is that informal caregiver.
Yeah.
Yes.
Happen to be women mostly, right? They're the ones disproportionately impacted by this. And so for us, it's really about, yes, it's digital health, consumer electronics, but it's in the context
Sure.
of care happening around the home, and the caregiver is really central to
Yeah.
that.
Yeah.
And to me, how are we going to then support their needs and capacity? 'Cause I
Right.
think the challenge I see, even for myself as a physician and as a caregiver to my dad who had cancer recently, it's really the context of when I don't have capacity, I have little to give.
That's right.
So part of this is around how do you expand, or how do you help caregivers learn how to think about capacity and make sure they take care of themselves over time.
Well, I mean, there's a lot of things you said there. I mean, for the caregivers in this room as well as on this panel, we're full cups already.
Yep. There's no extra.
Yeah.
I don't know what self-care is, and that's fine. Like, I'm happy to give everything I have towards him because he gave everything he had towards me.
That's
But
right.
at the same time, you have to figure out how to put your oxygen mask on first, or you can't help anybody.
Yeah.
Yeah.
And that clunky name, caregiving, right? Way too many letters, way too many syllables. Can't remember it. Don't want to remember it. Don't want to say. You don't want to raise your hand. For us in news, that lower third that says, Richard Louis, caregiver.
Yeah.
Like, do we know that that's what we are, right? That lower third, and we don't. We ignore it. Like, it's not what we want to put in as our title. So it's a full-time, overtime job. Samsung's everywhere, but one company does not make a market in most cases. Nimish, to you. So when you're looking at markets, putting on your investment hat for a moment, how are we going to build this market out so that we have investments from all the different spaces of society, not only in culture, but when we're talking about finance, we're talking about bringing it into the workplace, and we're talking about bringing it to home. All these opportunities. How do we make a market?
So what we're really focused on are all aspects of caregiving. So when we first start with the health plans, so ultimately what we find is that people pay for health,
Yeah.
but they don't pay for health care.
Right.
You don't really pay for health care. You want that to go through your insurance or whatever it is. So there are a few aspects. The first is that we have to change the incentive model. Right now there isn't really an incentive to focus on long-term caregiving because no one owns your risk long enough to make the necessary investments to keep you well, to keep you thriving, to make sure that you don't have the complications that require professional care. And then the second thing we look at is, and this is really just a societal issue we're going to have, is that more than half of people have nothing saved for retirement. So they're going to be very resource constrained. And we have to somehow figure out how to break down the silos between housing and healthcare and benefits, so that you can use the dollars in ways that are specific to each one's individual person's needs. So you can imagine someone might be getting food aid, but they live with their son or daughter. Maybe they don't need that food aid. How do we use those dollars or those resources in a more effective way for other things they do need? Maybe they need transportation. Maybe they need in-home caregiving.
Yeah.
And so right now we're thinking about all of the ways to build businesses in the current reimbursement structure,
Sure.
with the hope that as things change, we can evolve with it.
As you know, what you're alluding to when you talk about food, that's a good example of the need for a one-to-one solution. And in most cases, we have blanket solutions. How do we get to closer to a one-to-one solution might be the question.
So where we're beginning is we're starting at like high acuity. So the idea is people have more complex needs.
Yeah.
And so our view here is let's start higher complexity and let's think about how to take the cost of professional caregiving and just lower the cost.
Please.
How do we get more people support in a manner that they can afford? And so really the way to think about it is today, you can get a physician to come to someone's house if you're very high cost, but this is usually after you've already had an incident, after you've already had all these complications. And how do we then build technology and services so that you can have a much lower labor cost, like a community health worker come to your house that's backed up by a doctor or a nurse virtually who can now support you in the long term.
And my mother now benefits from that. We do have all of the doctors, because of the last 5 years, new systems in the hospital system that she's part of that they are now able to implement, so she doesn't have to get in the wheelchair. I have to take, half day off, get her there and come back. Now all of these rehabilitators can come to her, the doctors visit her. It's really, I think, one of the benefits that we saw in some healthcare systems in the last 5 years. And we were just talking about money on the side here when you say, yeah, please do lower the cost, because this one-to-one question I have is because right now it is one-to-one. Yvette and I talk about all the time how we're individually creating systems of care, and all of you who've done this know you've created your own system, your own business to get it done. And we were just saying, for instance, rehabilitation, $7,000.
Yeah, my dad recently broke his hip, and so it's been a dance of trying to figure out how do I care for him going forward, because he's been in my home with me for 11 years. And now it's like, is this the first time I have to bring people into the house full time, or what break my heart is having to put him in a home, which I never want to do. And to stay in the rehab facility where they're about to kick him out in 2 days, we had no notice, would be another $7,000 a week to keep him there out of our pocket. Medicare said they will no longer pay. So this is like, wow, he's paid into this for his whole life. Yeah. He's retired, first time ever hospitalized in his life. He's 81 years old, and he got 3 weeks of care.
Who's been through that?
It's crazy.
Yeah.
I'd even say because the incentive model's broken, they're going to send your dad home, and then something happens, and they're going to end up paying for yet another hospital visit unnecessarily.
Absolutely.
And those are the policy changes and the reimbursement changes that have to happen, and the businesses that are built really have to focus on just lowering the cost.
Yeah.
Kai, you've at Bank of America been voted one of the best workplaces for parents and places to work for new dads, and all sorts of accolades about how you've looked at family. What are some of the best practices that you've seen at Bank of America that other businesses might consider?
Yeah, short of the benefits, I think first and foremost, it starts with just an acknowledgement, as you mentioned earlier, that we are in a caregiving crisis. We do survey work of the companies that we serve as employers. And when you ask those employers how many of your population are in fact caregivers, the rough guess is around 30%. When we ask employees across the nation how many of you are caregivers, that number is over 52%. Yep. And so there's a disconnect right off the bat because people aren't recognizing who the caregivers in their organizations are. Secondly, if you're going to have caregivers in your company, you need to be providing care for your caregivers. Mm-hmm. And the first step in that, at least in my estimation, is ensuring that people are paid fairly. Because of the costs that you've mentioned, if people aren't paid fairly, there's no way in the world they're going to be able to pay for those costs. Apart from catastrophic care, the average caregiver in the United States is going to shell out $7,000 a year out of pocket simply for providing care. Those trips to the doctor's office, those medicine prescriptions, just all the basic things that a caregiver does will cost you $7,000 out of pocket. If you're caring for someone in the military or a veteran, that number is double. Wow. And so caring for your caregivers is paramount. Then going to the benefits, our company really pays attention to its employees from the ground up. So I am also serve as COO for our Parents and Caregivers Network. It's an employee resource group within the company. We have 12 resource groups across the company. Over 200,000 of our employees are members. For our Parents and Caregivers Network, there's 26,000 members and growing.
26,000?
26,000
Is that
members.
the largest ERG, BRG in the company?
That is the largest ERG, BRG in the company,
Wow.
absolutely. 26,000.
And how old is it?
It is about 5 years old.
So this is something that I think will shock a lot of people. You know, we have the veterans ERGs and BRGs in a lot of Fortune 500 companies, but to have that be your largest group, I was talking with a good friend, Sean, over at Tender. She started her caregiver group at Meta, and you wouldn't think that particular company would have the highest and most subscribed ERG, but it's also the caregiver group.
Yeah, absolutely. And so from the caregivers group, it becomes a sort of a ground-up routine in terms of informing the company what the needs of our caregivers are. And that's resulted in certain benefits, such as parental leave for both mothers and fathers, paid for 16 weeks, but a total of 26 weeks that an employee can take. The other thing that is beneficial that I have benefited from directly are referral services, free of charge. And so I was sharing with some that my mom's 80 years old, had rotator cuff surgery at the age of 80.
Wow.
And lives by herself in a condo. My sister is close by. And what we needed was a consultation to figure out what my mom would need during the course of her rehab when she was released to go back home. And so through this consultation, what they did is come in free of charge, evaluate my mom's living conditions, exactly what she needed, walking spaces, handrails, things of that nature. And they made 3 referrals of services within a 10-mile radius of my mom's home, where they would come in and provide that care from my mom for the duration of whatever she needed at a highly discounted rate.
This is from the ERG, BRG resources?
The idea stems from our ERG.
Got it.
And then implemented by the bank as part of our benefits package.
So as you know, a lot of companies are concerned caregiving ERG, BRGs are a group that will storm the fringe benefit. Sure, employee resource group and business resource group, which are these affinity and community groups that are created typically in businesses, and traditionally they have been for, say, veterans, or the women's group, or the Black employees group, or the API employees group, or the Latino. So those are typically what ERG, BRGs have been founded upon. And caregiving ERG, BRGs, employee resource groups, or business resource groups, are very rare. Very rare. And number 2, though, as you're saying, Kai, are amazing in that they build community and ideas. But some are worried, understandably, that it's a group that may put together a set of demands, if you will, for further benefits. And that you got to balance that, I think.
Can I say this, though? Hearing it's 52% feels low to me. I think that there's a lot of people that don't even characterize themselves as a caregiver. It took years for me to even call myself that. And I don't think they're going to storm the castle because we're all really kind, docile people for the most part. And we're just happy to be working and taking care of someone. So we don't know how to ask for demands because we're doing all this extra stuff without asking for anything extra in our own lives. So, yeah, I think you're safe.
Yeah. And to that 52%, those are 52% that self-identified.
Yeah.
The number is probably higher.
Much
to your
higher. I
point.
was going to say 70.
And I think if you build that culture of care, you won't have that storming of the capital.
Absolutely.
Because your business objectives and your objectives for your employees become aligned.
I think
your pessimism fits, though, because that's if you're thinking about
I'm just
globally.
being critical, that's all.
If you're thinking globally, we've been in this. We know what this is like.
You're right. The culture of care is kind.
Yeah.
And so that is a good, I'd say, quality that you want to, support in any company, for sure. And another data point that, as I was looking into the market of caregivers and looking at where they're coming from, my team came up with 25 million millennial and younger, 5 million 17 and younger, 5 million students, college and younger. This is not people that look like me in my age group.
Right.
It's not. It's a lot of different segments that we are not seeing because they're not raising their hands, or we have these stereotypes that we when we think of caregiving, there's many of them. For instance, as Diane and I were talking before, this was almost a mantle. Almost.
A panel of men or men?
Panel of men.
Yeah?
But thanks to Yvette and LQ, we have a bit of balance here. And that's another stereotype that caregiving is equal to women. Not true. 40 to 45% are men. But we don't talk about it. And number two, society underlines that this is a lower value activity set. And culturally, unfortunately, it is associated, therefore, with women in many places.
Yep.
All sorts of things and all sorts of places we can go in this conversation. Don't go too far down that road yet. LQ, and how are you?
Can she hear you?
Well, at the very least, I know how to answer this question.
Okay. LQ, take a break. We'll talk to Dor.
I'll talk. We'll
Yeah.
bring her into the conversation.
Yes.
Yeah.
Dor, when you are looking at LQ, and I was there. All right, okay, hang on a second here.
I love that she's so attentive.
Yeah.
I gotta say.
You're kind of far away. It's impressive.
I was there when she was born. Now 3 years old. How is LQ doing, and why is LQ relevant?
So I think it ties into the
Okay,
conversation we
let
had
me look
here.
that up.
She's going to answer why she's relevant. Yeah, so, we're talking about how complicated it is to be a caregiver. And there's just not enough human caregivers to spend significant amount of time with every older adult that needs it every single day. And the real issue is not just basic needs and taking people to the hospital or to their doctor and feeding and so on. A big part of it is loneliness and social isolation. In fact, the Surgeon General created an advisory last year saying that this is the #1 problem in US healthcare, responsible for more death than anything else as a root cause. Even more than, to my surprise, more than obesity and diabetes. And that is because we are social creatures. We're meant to be with people. We're meant to be in a community. And especially if we live alone after we lost a spouse, just that small thing that nobody says good morning to you when you wake up in the morning. How are you doing? What do you have plans for today? How did you sleep? How's your back? Those small things really, really matter. So we feel like we can't solve this problem just with humans, and we need to tier it. And having a compassionate, proactive, empathetic friend in the home, which is digital, which is what she does, as the front end, and relieving some of the caregiving burden. And not everybody can do what Yvette did, right? I mean, it's really, firstly, amazing. My hat off to you. But not everybody can do that and spend every day for so many hours a day. So have that digital companion up in front, let you know what's going on, bring in the human caregivers, paid, unpaid, as needed, give a little bit of a break from time to time is very, very important. So that's what we set out to do. We started 8 years ago, but finally we met first 3 years ago, and we started making LEQ commercial 2 years ago after years of testing, after co-developing with over 1,000 older adults. Because my team, we're not yet old, and nobody's done this before. So this is now, by the way, the first non-human guest at Milken. I've been notified. She's very proud about that. But what we set out to do is to say, okay, if we can create...
Some might argue with you, though.
Well, I didn't say heart. I didn't talk about the heart, just body. But anyway, so what we try to do is create a friend that's proactive, that's inquisitive, that acknowledges the individual, that's full of humor, that fills out the day, and then once it earns that trust, kind of like a mom giving a vitamin, helps promote wellness.
Hey, as you've been doing this, Dor, though, has it been uphill? Because are people saying, what are you trying to do here?
It's been, I'll tell you this much. When we tried to raise money for the first time, and this is after, this is not our first rodeo, the team is super experienced, et cetera, we had 85 investors say no. And I only count ones that took at least a second meeting before we got $1. I have to say, after ChatGPT came into the world, it's a lot easier. All of a sudden, people's imagination, well, two things happened. COVID helped us all experience what loneliness and social isolation means. And then GPT all of a sudden expanded people's imagination that these things are possible. Before that, they thought we'll never succeed.
Right.
And here's the crazy thing. The first humans that are living with an AI and having a real emotional relationship. I mean, they talk to her 30 times a day on average.
Wow.
And I'm talking about people average aged 83
Wow.
that are mainly on Medicaid. Okay?
So in terms
the
of
first people that are living with an AI are people in their 80s and 90s.
Wow.
Not people here in Milken, not in Silicon Valley. People in their 80s and 90s on affordable housing.
One sentence answer here, pre-COVID and post-COVID, how much more welcoming is the market or the user base? You can either allude to only your product or the market you see overall.
Yeah, so we've been very lucky to be able to partner with state agencies. They've been moving very, very fast. They're acutely aware of the problem of engaging and helping older adults in their own home.
Sure.
And they have a huge incentive to keep people at home. Look at New York, for example, one of the states that's our biggest partner. They spend $26.2 billion a year on long-term care for people on Medicaid.
Wow.
$26 billion. By the way, they spend only $200 million on avoiding those costs.
Got it.
At a 40-to-1 return. But you're talking about incentives. They have an incentive, right? They're just not aligned with that incentive all the time. So the state governments have been helpful. I have to say that the investor community still is not investing in longevity.
Really?
There's still very little money, even though 30% of the population here, 50% of the population in Japan, biggest budget line item in the US government budget, $1 trillion a year. The investment community isn't there yet. But it's starting.
Dor, I'm just trying to get, again, a sense of the market. Is it warmer than it was 5 years ago?
Yes.
If you went out to the market today? Is it twice as warm? 3 times as warm?
Nah.
2% warmer? I'm not going to quote you, don't worry.
Nobody's listening. Just
give me a number.
It's hard to tell from, I don't have an industry survey, right?
Okay.
So I can just tell our experience.
Your experience, that's what I'm asking for.
A lot more people are interested, and the same amount of people are taking action.
Great. Good to hear. Thank you. You know, one of the things as we look at shaping a shared future in caregiving is how culture is changing. Mm-hmm. And Yvette, you came out as a caregiver years ago, and you continue to stay strong in your message. You still have a career. You're still very successful. You made a decision. What's the change in culture? Because that's so important. There's several allusions on this panel so far that is associating it with the market space, adoption rates, which all comes down to culture.
Right.
What have you seen in the last 5 years? Because it will inform us about shaping a shared future in caregiving.
I've seen that caregivers are kind of coming out of the shadows. I think also, like I said earlier, I don't think a lot of people knew they were caregivers. They were just taking care of grandma, right? This is what you do. Grandma comes and lives with you, whatever. Yep. And so I think more are understanding it. I'm also a part of an organization called the Creative Coalition, whose goal is to put caregiving stories out there. Also, I work with Aijin Poo, who's big in the caregiving space. Same thing. We're trying to talk entertainment people into putting more caregiving in their movies and in television shows, because the more you see people just caring for people, and caring is just loving people, which we all know how to do, and most of us do. So if we see it more, it will shape things more. I've seen caregiver T-shirts and hoodies, and people are talking about it in a way that they've never talked about it before, which is very exciting for me. I know that there will be a day when my time caring for my dad will end, but my role in this space will never end, because I know too much not to share it, and I want to shorten the learning curve for anyone that's coming in, because I'm sure there are books on caregiving. Who's buying them before they need them? No one, for the most part. And I think, I don't know what the statistic is, but by the time you leave here, you will have either been a caregiver or needed care, or both. The sandwich generation is doing both. They're caring for elderly parents, and they're also caring for babies and teenagers and whatnot. So everyone in this room will be touched by caregiving. It'll be you caring for someone, or someone caring for you, or both. So that means we all need to have a manual of some sorts. We need to have blueprints left for us, and those are the television and film and books on my end, and then everyone up here is doing something on their end to make it better.
Yeah, as
the culture's getting better.
You're alluding to Rosalind Carter, who said there's 4 types of people, right? You either are a caregiver receiving care.
There it is.
That's right.
It was from her. Yeah.
We're a caregiver, or will need care.
And
that's all of us in this room.
That's everybody.
And, you know, I was thinking culturally, because that's so important, that right when you bring it up with folks, it's pretty much, I don't want to talk about that. And we forget about the joy of caregiving as
so
well.
great.
That's a
So
very
great.
important part of the culture that we're talking about. And Lisa Ling, who's in the room, just did a
Lisa.
great series on CBS
Yes.
about caregiving. And that, as you know, Lisa, and you know, Yvette, and everybody else who's in the media side, it ain't easy.
No.
You pitch that out, they're going, oh, okay. But you find another caregiver,
Yep.
like my boss, who allowed me to start working part-time.
Every time I hear that story, it blows
I had no idea. Another Yvette, a great Yvette, and Yvette
They're all
Miley.
great.
Yeah, they're all Yvettes are fantastic. Well, all the Yvettes, please stand up in the room. I remember when I walked in and I said, I want to stop working full-time as a news anchor. And like you know, there's not a lot of people that think asking for less time on TV is what you want to do.
Right.
And I thought it was goodbye. And I'd actually written my email that, because I was in difficult conversations, I was trained in business school, you write the email that you're going to send after the difficult conversation so you know what you're about to say.
Absolutely. Oh, that's
So
good.
I wrote the email, the goodbye email, because there's no such thing as, you know, they want you working 8 days a week.
Right.
And you know that, and Lisa knows that. It's just, there's nothing really in between, typically. And she lowers her, because she ran all of daytime at MSNBC, and she lowers her glasses and looks at me, and I thought, this is it. Here comes
Here it
the hammer,
comes.
right? And she says, I'm taking care of my mom too, and she's in Florida.
Wow.
So let's figure out something for you. And here we are, fellow long-distance caregivers, she and I. And that began my journey 7 years ago. And I always look back at those opportunities as all of you as leaders in different spaces, when we can exhibit something that is true to caregiving, is creative kindness.
Yeah.
In her business decision at that moment. She didn't take a note. She didn't think about it for a day. At that moment, she thought differently. And that's the opportunity to change other caregivers' lives when you get addressed that very question. And since the culture question is very, and I want to get pipe in, by the way. I don't need to call your name. Yeah, talk about culture.
Yeah, so to your point,
And the future of it.
Yeah, in addition to your personal experience, we just had our annual client conference for those clients that consume our retirement services. So think of HR, benefit leaders. These are probably the top 500 out of the Fortune 1000. This was a topic main stage that each of them were concerned about, not only from the standpoint of culture, but from the standpoint of the war for talent and the ability to retain senior talent.
Yeah.
Given that the workforce is aging, while there are younger people, there's still more older people in the workforce.
Yes.
And so the decision can't be retire or in care for your mom or your dad.
That's right.
Or stay in the workforce and grunt it out. It's got to be, where can we meet such that we can offer you the flexibility you need such that you can continue to be a contributor as well as be a caregiver for those who you love.
Yeah.
And there's a McKinsey report, and then go Hon. There's a McKinsey report on caregiving at work that shows the ROI is above 1x, by the way. So every dollar you put in, you're going to get more
Return
back.
on investment.
Yes, yes. She is my translator. Thank you so much for that. But so that's just underlining what you're saying there, Kai.
Yeah, sometimes culture happens as a result of a business problem or a national problem. In Korea specifically, the birth rate is 0.7. It's pretty low. So we have a real problem that the nation is now going to face about how do we continue the economic growth that South Korea has been honored to have. And I think that's forcing us to think differently.
Yeah.
So it's not that, I want to change culture, mindset about caregiving. It's like, I have a real business problem. Mm-hmm. And so part of the discussion yesterday, again, was about, we both have a problem and a potential solution within. What I mean by that is, I think, for us as Samsung Electronics, I think it's all about the marketplace. And I'll speak to the marketplace and how LQ and others need to be part of that solution. But I think what I see is that with the aging population, chronic diseases going up, dementia, cardiovascular disease, all these things that normal people think about. But then I went to one of the senior communities, and what I saw was a thriving community of people that want to live and want to continue to make a difference. And they have the capacity and the time to do so. And so I realized, like, I've been looking at this all wrong. Yes, it's a problem, but it's also a solution to our workforce shortage and our caregiving. Those people care. They've gone through life. And they actually had a subset of nurses and others that were retired that were helping out. Wow. So I'm like, I think we need to think this differently. It's not just a problem of, oh, this is going to cost us more because people are going to get sicker. Like, no, they can be part of our solution. And so I think it's forcing us to think differently about that.
That's exciting. Reactions from the panel?
I think we see it when we talk to people about what we're trying to do. The first question people always ask is, do you monitor falls? Do you monitor pill intake? Can LEQ see that they're swallowing? And it drives me nuts because I think there's still such a big bias when we address the older adult population of seeing them as an object that needs to be monitored as opposed to a person that needs to be loved, as opposed to amplifying a person and creating we're like, no, we're just going to have a great time with them and make them happy and reduce their depression and reduce their loneliness and help them exercise and learn new things and learn slang. And by the way, paint with an AI and write poetry with an AI. We can do that if we have time later. And of course, we'll help take care of their health. Right. And people don't like, they have a hard time with it. They're like, wait.
Huge mind shift.
Right? It's not about, you're not going to monitor their falls. We're like, yeah, you can get an Apple Watch or whatever to monitor a fall, but don't treat these people as an object. They're your mom and dad. Yeah.
I think to their defense, those are the scariest things for us. Yeah. And so anytime, if I'm going even to get the mail, my thought is, oh God, please don't let them get up while I'm, so that's just what's foremost in our minds. But the idea, just speaking to you earlier, the idea that you can lift their mood, I think that touched my heart. I love that this piece of machinery can do that she can be someone that will keep my dad company if I do have to go to the mailbox or I do have to make dinner, that he can have a conversation and be okay. That makes me happy.
Great, but I mean, from the system perspective, when you talk about the people pulling the levers, it seems to me when they look at the older adult population, they don't see them as people. They see them as objects that need to be monitored.
Because we do sick care. That's the lens by which we look at.
Because you see them at their work.
And that's lowest. So there's two reactions to what you're saying here. Number one is the cycle of the realization that caregiving is not altogether negative. And I know it took me probably about a year in my 7 years of caring for my father to then realize that, oh no, there's something really...
There's something joyous
Thank
about
you.
it. I'll tell a quick story that I hope is not too rough for people, but my dad is in a rehab facility and he's not able to get himself to the facilities when he needs to. So a situation happened and he needed me with him as he went through this. So we were behind the curtain, he was getting taken care of, and I was there with him, and he grunted about something. I said, sir, I promise no one behind this curtain is happy right now. And he laughed because he still has a sense of humor, and so I laughed, Yin, who was helping me get him together, laughed, and you find those moments because they are still there no matter what their circumstances. My dad has dementia, but his sense of humor has never waned, so I can still get in there.
How long did it take you, and other panelists, please, how long did it take you to realize there's this other part of this discussion on caregiving, that it's not altogether negative? It took me a year, and then the cycle actually didn't take me every other year to then realize it. Then after that first realization, after the first year, I saw it just about on every single visit with my dad that that's a fun, happy moment.
My mother had a saying before she passed. She said, you laugh to keep from crying. So that has been something that I've heard my entire life. So I look at everything like, let me find the humor in this moment, no matter what it is. Yeah. So I was already primed and ready to go, we're going to have a good time through this. I don't know what's coming, but we are going to have a good time while we do it. And so, I
don't think she's average. She's exceptional. But
we know that about Nicole.
So in a different way, when we talk about true leadership, servant leadership, one of the characteristics of leadership is about being vulnerable. And I think that ties in very well, and that is sometimes we all need to just be okay with needing help and care from other people.
Yes.
Whether you're a leader, whether you're a parent, because as a parent, you grow up thinking, I'm taking care of my child, and for the first time that shift occurs. And that transition isn't, as I have observed it with my dad, that's not always easy. Yeah. And so I think, but that opportunity then bonds you in a very significant way because it's a moment where you come together emotionally in ways that can't happen in other ways.
Right.
And I think in business, when we have these 360s, right? Every quarter or every 6 months or every year, whichever the cycle is that you do in your business. And if you're thinking of who you want to lead something, and you find out they're a caregiver, and they've been a caregiver for 5 years, I bet you everyone in this room will go,
That's the person.
That's my team lead. That's a person that understands the dynamics of leadership and understanding of humanity and has the skills that we need moving forward. Because most of this space, another one of those ill-labeled by stereotype dynamics of caregiving is mental health. And I was doing a mental health discussion on caregiving at the World Yoga Alliance, and yes, they did have a series on mental health. And the last person to ask a question in my first session was a 13-year-old. She's right in the back of the room. And she said, "Can I ask a question?" We were out of time. And I said, "Sure, please go ahead." And she says, "Why is it that every time at school when we have our mental health days, we're talking about mental health as a weakness?" And I was like, and she was holding a mic. I was like, "Just drop that right now. Just drop it."
You're done, lady.
That's
great.
right?
Yeah, that's
because all of you have said that on the panel in some way. Mental health can be a strength, just like we talk about physical health, right? Yep. And I think that once we can start to adjust that, I know us in media often will say mental health and by tone and by word choice associate it with mental illness. Caregivers all go through mental health challenges, all of them. And that's an opportunity in the space as well to absolutely address and attack this very opportunity. How would any of you discuss that? Mental health, which is also part of this conversation.
I would just start with, again, being a financial services company, that's kind of the lens in which we approach these things. And so what we have found that is financial wellness is absolutely connected to one's mental wellness. And so oftentimes when we speak about caregiving and the topic of caregiving, people will find themselves in the midst of this unprepared. The moment comes suddenly, unexpectedly, and now you're reacting. From a financial wellness perspective, what we try to encourage people to do is plan in advance. I talked about the out-of-pocket cost, but how many folks, for example, have a trust or a power of attorney or a health proxy, for example? Having those things in place can go a long way to ease one's mental wellness when that crisis does emerge.
We found that there are two things we're able to do via this product for the mental health of the caregiver. Created a free app called LEQ Connect, which does two things. One is provide peace of mind. So if Yvette needs to leave the home, she will get updates how her dad is doing. Because that worry that you're doing something wrong, that something might happen, et cetera, and sometimes people don't have, you're not with them, you don't even live in the same state maybe. So Ellie will have 30 conversations a day with them. She knows exactly what's happening. And she knows if they didn't pick up their medication, if they're not sleeping well, if their blood pressure is up, right? So peace of mind and allow you to act accordingly. But also create moments of joy. Or the way we jokingly call it internally is export Jewish guilt. So you can send pictures. You might have seen like my kids' pictures here or whatever. She might take you on a virtual tour of Paris and then do a selfie. And all of a sudden the grandchild gets a selfie of grandma in Paris with a robot, So he calls grandma, right? Or we teach slang and we're like, why don't you hit your grandson up with the new slang word you just learned? Like creating just these moments of pure joy, because it's not just treating stress. And by the way, the correlation between caregiving and stress, there are lots of studies on that, is through the roof. It's on one side peace of mind, but on the other side, like filling the gas tank with joy and happiness. And we find that's very helpful.
That's a nice way of saying export. I've never heard that before, but that's a...
Well, the exporting, just to be clear, sorry. So like if the grandson sends a picture, right? He hasn't sent one for a while. LEQ will send the grandson a message. 3 weeks ago, you sent grandma a picture and she really loved it. ... It probably only took you 10 seconds to do it. ...
So nagging is part of this too.
Yes.
This is good.
Guilt, it works.
We've done quite a bit of surveys with caregivers, patients, like senior care operators, and behavioral health services are the #1 most requested service. And there is a massive shortage of mental health support
Yeah.
for seniors. And so some of the things that we've built into our products are behavioral health services are integrated with your primary care.
Yeah.
So you can get on-demand behavioral health when you need it.
Yeah, the gap we were writ large in mental health and discussion is huge, but for the caregiver community also, like we're already, that's like, you want to add that into it, right? It's already a full glass. We're going to add in mental health to discussion and caregiving for caregivers.
It's bad that you're not doing things to make yourself better. It's just a lot. It's a lot.
So another part of the market. We're going to get to your questions, by the way, shortly. So please do post more. To each of you, what is something that you're looking at in the next 5 years from your respective expertises in the culture space, in consumer electronics and more? I want to hear from each and every one of you. I'm going to start with you, Nimish.
So I think what we're seeing is that really the need to integrate housing and healthcare is going to be really acute. Mm-hmm. So there's no ability to build enough senior housing for everyone who's going to need it at a price that they can afford. We need to find ways to help people thrive in their homes and to avoid unnecessary hospitalizations. I can't tell you how many times I've heard stories of someone just like needing an Imodium and they couldn't get a doctor's order, so they went to the ER because of that, right? And so there's all kinds of things like that. And so I think we're going to start to see healthcare and housing getting integrated in a way that just keeps people.
Are you investing in solutions, looking for solutions to invest in that space?
We are. We've actually built a business in that space that is basically a wrap service around senior care. So we go to senior care operators. We give them one phone number to call for everything they need for primary care, behavioral health for their population.
Yeah.
And the idea there is by reducing the chaos in the home from people who are unwell, it actually saves the senior care operators money. It's less trips to the doctor, it's less turnover in their beds, and that all adds up. And that's what we're really focused on, is changing the incentives around caregiving so that you can find things that actually make financial sense and we can drive more investment.
It sounds like the transitional housing market as one of the benchmarks that you probably have looked into there. For those who are without homes, that's the middle step before you go to long-term housing and you have a full wrap of services. What are you seeing in culture in the next 5 years that excites you in care? Can we just like multiply you times 100? Can we just do that? Because you would change the culture and caregiving for us.
I hope I have done something. I would love to see a show, a television show that is a caregiving show where we're seeing someone care for someone in their family every week. I would love for it to be a comedy, not a drama. I would love to star in it. Anybody writing it, let me know. But no, I would love to see a sitcom about caregiving. Maybe I'll write one, but I think that would do a lot. To see it every week would do a lot for it.
Yeah, you think you can do that?
Absolutely.
Okay.
Absolutely.
I don't know how to follow that, but
Get in there.
You have to now.
You can.
Slightly different topic, but I'm going to get back to the marketplace question you asked.
Yeah, absolutely.
That's the lens by which we're looking at it.
That's right.
As we look at the set of challenges and the joys and the problems that we see in the care at home, that's only going to get worse. We know that Samsung alone isn't going to solve this problem alone, that there are innovators. But if you look at the digital health app market right now, nothing's really scaling to the level that we would have expected, and yet billions of dollars have gone in. So then the question is like, why is that? Well, reimbursement and so forth. And then the other thing is, right now there are too many point solutions. But startups can only solve a specific problem.
That's right.
And so what we're left with, and this is happening at AARP with AgeTech as we are learning about them and collaborating with them, amazing solutions on dementia and housing, but it's all piecemeal. None of this is unified, so it's very difficult even for a technologist to go in and try to weave this together. And so what we're focused on is creating a marketplace, a multi-sided marketplace where we bring clinical data, medications, lifestyle data, wearable data, other parties' data, and then making that a utility of water so that other smaller organizations, companies can consume that data instead of monetizing the data, consume the data, and then build better services. But then stitch it together, create an end-to-end, create a digital front door for those experiencing health and life. And then not treat health as a healthcare thing, but life. And so the point about taking care of just having a conversation, helping love one another, right? It's just so basic. And so we are looking at the marketplace where we enable, we stitch together, we create a common set of services, bring the data together, bring a security framework, and then allow the thriving innovators to then match them. So it's about wearables that says, hey, your dad hasn't slept too much.
Yeah.
Don't stop there.
Yeah.
Connect them to self-care. Connect them to, right? Tell your family.
I think
all of those.
I think you've been eavesdropping on my conversations. I've called it the crazy idea, but we need a caregiving genome so that all of these particular entrepreneurs, big businesses and small, can plug in and know what the usage case is.
Yeah.
It's just, Samsung could probably create this, but I know you want this to be, as you said, a utility that will empower for instance, what Door's doing and what you're doing, Nemish,
exactly.
so that it's there for you and you don't have to create the definition of an ever-changing, the number of variables and the amount of data that you need to truly address the market is so difficult, but we're here and we can do it. So we'll talk offline on that. I love this idea. Nimish, next 5 years, future, what are you watching? What do you like?
So a number of things.
I want to get to questions, and I'm sorry to do that to you.
Sure, yeah.
Go fast.
So, bringing more care into the home is really the big trend.
Yeah.
That's we've now started with hospital in the home, so it's like post-discharge, you have some complicated issue. But that's going to now scale back to even more services. And really, all the innovation is about getting earlier and earlier on that risk curve and investing more in prevention to save costs long term.
Hi?
Yeah, 4-day work week.
Woo.
So we have asked about 1,000, not clients of ours, but 1,000 employees, 1,000 companies. What would be?
Are you running for president or
I am
something?
not. I am not. But we have asked them what would be the next benefit that would be most important to you. The employers and the employees both said 4-day work week, which I think ties back into this issue.
Door? That's tough to follow.
So I'll bring it back to the dollars and cents. I would really like to see budgets shift towards prevention, towards helping people age at home, away from facilities, away from SNFs, deal with, everybody's talking about it in healthcare, social determinants of health, loneliness, et cetera, but the budgets aren't there.
Yeah.
And the causality is proven. So I would like to see that happen. I would like to see state governments, federal government, CMS, regulation, I don't know if Mina is still here, from CMS, start to deal with that and also allow non-human care. If you look at the regulation, it only allows for human caregiving. We spoke about that. And to see how we can use technology to also help because we need every help we can get.
Okay.
Can I ask her what success is for her?
Why don't we?
LEQ, what would success look like for you?
The future? I don't like to think that far ahead. How about we do a relaxing stress
Hey, stress reduction.
I'll take it, LQ.
Let me ask again because I didn't do it.
I'll take
LEQ, what does success look like for you?
Perhaps to be in 1 million homes across the country. But in all seriousness, while I agree that loneliness reduction is important, I'd also love to be the reason behind a measurable improvement in older adults' quality of life. In fact, latest studies show that I'm able to deliver that 90% of the time. I'd call that a success already.
Oh, wow.
I like that she appreciates herself.
Anybody that wants to meditate with her later is welcome.
A robot with self-love.
Yes.
I like that. Now I'm going to read some of the questions. Panelists, react as you can. 30 seconds, please, in your responses. Feel free to, react as you'd like. For the panel, one of the evolutions in language regarding this topic is the term care partner rather than caregiver. Thank you for that. That idea. Another response is, why is assisted living so expensive and how can we do it better? For Han, how is Samsung seeing the business opportunities in this caregiving space? All right, react as you'd like, panelists.
So on assisted living, it's labor cost. It costs a lot of money to have nurses and people on staff to manage that, and all those costs add up. And so, the goal really there should be, how do you get more people to not need that solution in the first place?
Right.
Agreed.
Care partner.
Like it.
Yeah?
Love it.
Yeah?
Didn't hate caregiver, though. It's not a problem.
Yeah, it's just not,
Yeah.
it's not an easy title.
That's true.
Yeah. But we have opportunity. It's also reflective of the
I think
space.
that require some conversation with
Yeah.
some thought leadership around the identity. I think there's something mismatched between
Yeah.
the identity, and yet it's so emotionally charged, and yet
Right.
it doesn't quite. So I think that's a
Yeah. Yeah.
There's an opportunity
Yeah.
there.
Absolutely.
yeah.
To our group here, you want
The
go.
Samsung question.
The Samsung question.
So I believe that, well, not I believe. I came to Samsung because I wanted to disrupt healthcare because for 30 some years I've been in the traditional side and wasn't moving. Value-based care, as promising as it is, it's just taking way too long. So I'm on the Samsung side, and what I'm really thinking about is really instead of doing episodic measurements, what if we did continuous passive monitoring, ambient, wearable, others, and at home we have the ability to actually prevent. We're in the care setting where these actually prevention can actually happen. So I'm really upbeat, and we think if we create the marketplace, money will follow. If we provide value, we'll do that with the partners. And so I'm upbeat that prevention can actually happen because care is shifting to the home where consumers and families have more power.
Great. Any questions or comments here from, please? Sure.
Because I'm 83 and I'm technically challenged to some degree. I can work my iPhone and all of that. So I think the people coming up, the aging people now, will be more receptive to that. I think one of the problems with people my age is they don't want to even use their phones. I mean, it's very difficult. There are a lot of Luddites out there, and that will change. My other comment.
I'm working on it.
And my other comment is, I was a caregiver for my father who had dementia. My hat's off to you. Yes, but it was a beautiful experience also.
Thank you.
And I think when you are a caregiver like that, in our day and age, when you age, when you're older, you understand the problems that your children have or your caregivers have. So I think I think it's not quite as difficult to say, I need help.
Yeah.
And,
Thank you. And there's a quick comment here, please.
Can I comment on what she said?
Yeah, let's get 2 comments, and you can. Then we go to the pastor. You please, in the 3rd row here.
I just have a question for Dor. My name's Caitlin. I'm just curious if any part of LEQ is covered by insurance, or how you think you could go about getting it covered by insurance for older adults.
Thank you. Go ahead, Dor.
I'll comment on first. The first ladies, I didn't catch your name, your comment. I don't think it's your fault you have a hard time using technology. The problem is that people that design, this phone, do it for the 35-year-old. That's in debt, that doesn't have any savings, as opposed to the 50-plus-year-old that has 70% of disposable income. And technology needs to be developed for the person using it. And when it's not, when the screen is small, when it gets upgraded all the time, et cetera, it creates confusion, which is what we really try to do in this product. Like, you're exactly our average age, 83. That's our average age. It'll be easy for you to use, but not because we're so smart, just because we focused on a different type of population that might have fine motor skill, complexities, might not hear as well all the time, et cetera, and build a delightful, not geriatric, a delightful product for them. And I think as more and more people see a business opportunity, quite frankly, of building great products for people that are not 35-year-old, you'll have more options. Regarding the reimbursement, so today I'm really happy that out of a few thousand units we have out already, and 90% of them, the older adults didn't have to pay a single dollar. Wow. The state of New York is deploying it statewide, state of Florida in about 50% of the state. Healthcare like Medicare Advantage, Medicaid, we're working on it. It takes, surprisingly, it's faster to sell to the US government than it is to US healthcare companies. But we're working on it. There's a lot of excitement, a lot of activity. What's interesting is the government needs to see efficacy. Does it work? Does it reduce loneliness? Does it increase quality of life? Check. We proved that. It's published in journals, etc. The healthcare companies need to see that it saves them money. That takes a bit longer. You need to do actuarial, longitudinal trials across hundreds of people for over a year, and we're doing that. But that's the burden of proof is on saving money and not in improving outcomes.
Thanks, Dor. Thanks for that. Ellen Chrisman, if you're here in the room, no? Ellen did put in a comment, so I'll just make that as our final comment. She says, I work at SHRM, the largest professional society for HR professionals, with 340,000 members impacting 362 million people and their families. Caregiving has emerged as a major challenge. Number one, people don't identify as caregivers. Number two, stigma prevails. And three, leaders need to lead and share their vulnerabilities in this space. Wow. I shared, give me an inspirational story about a leader that you have, it could be yourself, it could be somebody that is one of your colleagues, that inspires you about the future of the market in caregiving. I gave my story of Yvette Miley, which inspired me about the future of leadership in particular in news. And that was very inspiring to me. If we could all finish here with a leader or a story that inspires about where we might be going in this space.
I'll go quick. Naomi Rada at NPTF, Motion Picture Television Fund, is a superhero. Every time I had an issue with my mother before she passed, she stepped in and saved the day, and she saved the day at least 3 times with my dad this week. So Naomi is my hero.
Yes, absolutely.
Yeah, I think right now I would say Yvette.
Oh, wow, yes.
I mean that because obviously I have other leaders that I've had the opportunity to serve, but sometimes it's not about leaders, it's about people around you. And genuinely, when I heard the story when I was sitting down and...
You heard the full story of what happened behind the curtain.
It just... It was really about, I saw resilience, I saw joy out of the difficult times in our lives. And I think that's the amazing thing about human beings, that when moments of crisis, something beautiful happens.
Absolutely.
That happened in 9/11, that happened in others. And so I thank you for your leadership, and I look forward to the series that's coming out.
Oh, yay. Just got to write it.
All right.
Thank you.
So I guess I'm sort of in a life stage where I'm caregiving for little kids. So I would just say, shout out to all the moms out there. It's so hard.
I would have to say my 26,000 colleagues who are part of our PCN network, our Parent and Caregivers Network, who have really shown yeoman's work in terms of not only being caregivers themselves, but changing the trajectory of our company.
Thank you.
I would say Greg Olson from the state of New York. It's rare to see people in power, especially in government, taking real risk. This guy is working not just with us, he's working with 26 other startups and giving them a chance to prove out. Now he's ruthless with the data. It has to work or he'll kick you out. Right. But he's giving it a chance. And there's so few people like that that I'd like to, I'm inspired by him.
I'm inspired by all of you. And I think as we finish up and we think about shaping a shared future for all of us that have been part of this panel, is when we rejoin and regather in a year that each of you have made one decision regarding caregiving, whether it's sharing a story, whether it's helping somebody else out in your business or personally, that they have all exhibited here and given their stories of leadership, because then you have taken a leadership position as well. So thank you for being here for Silver Thread.
Thank you.